Our digestive system is amazing. It breaks down the food we eat. This gives our bodies energy and nutrients. But sometimes, our digestive system can become inflamed. This means it gets swollen and irritated. Inflammatory bowel disease, or IBD, is the name for a group of conditions that cause this inflammation. The two main types of IBD are ulcerative colitis, or UC, and Crohn's disease, or CD. They are chronic conditions. This means they can last for a long time. Both UC and CD can be painful and disruptive to daily life. Understanding the differences between them is important. This knowledge helps doctors give the best treatment. It also helps patients understand their condition. This essay will explore these two conditions. We will look at how they are similar and different. We will discuss their causes, symptoms, and treatments. One of the key differences between UC and CD is where they affect the digestive system. Understanding these differences is crucial for both patients and healthcare providers. UC, or ulcerative colitis, is like a homebody. It only affects the colon, which is also known as the large intestine. The colon is the large intestine, and it plays a vital role in the final stages of digestion. It's the last part of the digestive system responsible for absorbing water and electrolytes from indigestible food matter. UC inflammation starts at the rectum, the final section of the colon. That's where poop leaves the body, making it a critical area for UC symptoms. Then it spreads continuously up the colon, affecting the inner lining in a uniform manner. CD, or Crohn's disease, on the other hand, is a world traveler. It doesn't limit itself to one area. It can affect any part of the digestive tract, from the mouth to the anus. This includes the mouth, esophagus, stomach, small intestine, and large intestine. CD inflammation is patchy, meaning it can appear in isolated spots. It appears in different spots, creating a pattern of healthy and inflamed tissue. Imagine a map with scattered dots. That's what CD inflammation can look like. These patches can cause a variety of symptoms depending on their location. Plus, CD inflammation goes deeper than UC inflammation. It affects all the layers of the bowel wall, not just the inner lining. This can lead to more severe complications. This difference in location and depth of inflammation is important for diagnosis and treatment. It helps doctors choose the best medications and procedures tailored to the specific type and location of the inflammation. Understanding these nuances can significantly improve patient outcomes and quality of life. While both UC and CD involve inflammation, our bodies react in slightly different ways. These differences are crucial in understanding how each condition affects the body and how treatments can be tailored to address them effectively. Think of it like two different alarm systems going off. Each alarm signals a different type of emergency, requiring a unique response. In UC, the body's immune system mainly activates what we call the E2 cells. These cells play a significant role in orchestrating the immune response. These OE2 cells release specific chemicals like IL-5 and IL-13. These chemicals act as messengers, signaling other parts of the immune system to respond. These chemicals cause inflammation in the lining of the colon. This inflammation is typically more superficial, affecting the surface layers of the colon. Picture it like a fire hose spraying water only on the surface. The water doesn't penetrate deeply but still causes significant disruption. This inflammation makes the colon lining more permeable. A permeable lining means that substances can pass through more easily than they should. That means things can pass through it more easily, leading to symptoms such as diarrhea, pain, and bleeding. This increased permeability can also allow harmful substances to enter the bloodstream. CD involves both Th1 and Th17 cells. These cells are part of a different immune pathway and lead to a more complex inflammatory response. These cells release a different set of chemicals, including TNF-alpha, Illinois, 12, and interferon gamma. These chemicals are more aggressive and can cause more extensive damage. These chemicals create a more aggressive inflammatory response. This response affects not just the surface but also the deeper layers of the intestinal wall. Think of it like a jackhammer breaking up concrete, affecting deeper layers. This kind of damage can lead to more severe symptoms and complications. CD is also linked to gut dysbiosis. Gut dysbiosis refers to an imbalance in the gut microbiome, the community of bacteria living in our intestines. That's an imbalance of good and bad bacteria in the intestines. A healthy gut has a balance of beneficial and harmful bacteria, but in CD, this balance is disrupted. This imbalance contributes to the inflammation. The presence of more harmful bacteria can exacerbate the immune response, leading to more severe inflammation. Understanding these different inflammatory pathways is crucial for developing targeted therapies. By knowing which cells and chemicals are involved, researchers can create treatments that specifically target these pathways, offering more effective and personalized care for patients with UC and CD. Section 4. Who gets IBD? Unraveling the epidemiology. IBD affects millions of people worldwide. UC and CD are more common in developed countries, especially in North America and Europe. They typically appear in young adulthood, between the ages of 15 and 30. However, they can develop at any age. While both conditions affect men and women, there are some differences. UC tends to be slightly more common in women. CD shows a more balanced distribution between genders, although some studies suggest a slightly higher prevalence in women. There is also some variation in prevalence among different ethnic groups. For example, people of Ashkenazi Jewish descent have a higher risk of developing both UC and CD. Section 5. Genes and environment, the roots of IBD. In this section, we delve into the intricate interplay between our genetic makeup and the environment we live in, and how these factors contribute to the development of inflammatory bowel disease, or IBD. What causes ulcerative colitis, UC, and Crohn's disease, CD? It's a complex question with no easy answers. These conditions are multifactorial, meaning they arise from a combination of various elements rather than a single cause. Scientists believe that these conditions develop due to a combination of factors, including genetics and environment. The genetic component provides the blueprint, while environmental factors can act as triggers or accelerators. Think of it like baking a cake. You need both the right ingredients, genes, and the right oven temperature, environment, for the cake to rise properly. Without the right balance, the cake won't turn out as expected. Similarly, for IBD to develop, a combination of genetic predisposition and environmental triggers is often necessary. This means that even if you have the genetic markers, you might not develop IBD unless certain environmental conditions are met. Both UC and CD run in families, suggesting a genetic component. If you have a close relative with IBD, your risk of developing the condition is higher compared to someone with no family history. However, the genetic link appears stronger for CD. Research has identified several genes that are associated with an increased risk of developing Crohn's disease. Several genes have been associated with these conditions. These genes can influence how the immune system functions, potentially leading to the chronic inflammation seen in IBD. For example, mutations in the NOD2/CARD15 gene are strongly linked to CD. This gene plays a role in the immune system's response to bacterial infections, and mutations can disrupt this process. For UC, variations in the IL-23R gene have been implicated. This gene is involved in the regulation of immune responses, and changes in its function can contribute to the development of inflammation in the colon. Environmental factors also play a role. These can include a wide range of elements such as pollutants, lifestyle choices, and even the bacteria that live in our gut. Smoking is a significant risk factor for CD. It has been shown to not only increase the risk of developing the disease, but also to exacerbate its severity and complicate treatment. It can actually worsen the disease course. Patients who smoke often experience more severe symptoms and a higher likelihood of requiring surgery. Other potential triggers include diet, infections, and stress. A diet high in processed foods and low in fiber, for example, may contribute to the development of IBD. However, the exact role of these factors is still being investigated. Ongoing research aims to better understand how these elements interact with our genetic makeup to influence the onset and progression of IBD. Please, subscribe now to join our community. Give a thumb to encourage us to bring more interesting, challenging, and high-quality videos to everyone. Our channel, Medicine Health 360, has many more videos to get the crucial, latest, and systemic medical and health knowledge with a simple approach to everyone for better health and a better life. We value your feedback, so please share your thoughts and let us know what topics you'd like to see next.